Hello and welcome. My name is Dr. Henry. Now in this video, we are going to discuss the sensory system examination of both the upper and the lower limb. So during the examination, we are going to examine different modalities which are carried by different tracts. For instance, we are going to examine the light touch, vibration, and proprioception. These are carried via the dorsal columns. We're also going to examine pain and temperature, which are carried by the spinothalamic tracts. Then we also examine crude touch, which is somehow carried by both pathways and usually considered together with light touch. So these are the different modalities we're going to examine in this examination. Now, some key concepts to note here is what we know as dermatomes. So understanding dermatomes is very crucial for sensory nerve examination and sensory loss patterns. So when we say dermatomes, we mean areas of the skin which is supplied by a specific spinal nerve. And this is crucial in understanding sensory loss patterns. This will indicate the level or the nerve root a lesion is in. So understanding dermatomes is actually very crucial. But in examination, there are various OSCE references we use. But during OSCE scenarios, the most commonly tested regions, at least, are the following. For the upper limb, we're going to test for C4 at the deltoid, then C5 at the lateral arm, C6 at the thumb, C7 at the middle finger, C8 at the little finger, and then T1 at the medial side of the arm. Then for the lower limb, we're going to test for L2 at the anterior thigh, L3 at the knee, then L4 at the medial aspect of the leg, L5 at the dorsum of the foot, and S1 at the lateral foot. While it's important to understand all the dermatomes, for the purpose of OSCE scenarios, these are the ones we commonly test due to time constraints. So we're going to go ahead and start the practical. Like we said, in every physical examination, we have the pre-exam, the exam itself, and the post-exam. In the pre-exam, you greet your patient, introduce yourself, then take permission from the patient, then you perform your hand hygiene. Whereas in the post-exam, you thank your patient and then probably explain the details of the examination to your patient. So for the pre-exam, we're going to greet our patient, introduce ourselves. If you found this video helpful, please drop a like, subscribe if you haven't already, and turn on your notification bell so that you don't miss the next one. Also share this with your friend who might need it. So, hello, good evening. Good evening. My name is Dr. Henry, and I'm here to examine your sensory system, which will involve me touching you with cotton wool and checking your pain sensation with pin. Can I go ahead? So now I'm taking permission. You perform your hand hygiene. So you perform your hand hygiene. For the light touch, I'm going to make use of the cotton wool. Now, before you start the examination, you have to test it on the patient so that they'll know how it feels. Then tell them to close their eyes. So when they close their eyes, tell them to say yes whenever this thing touches them. Okay? And don't prompt your patients. Don't prompt the patient by asking them, is it touching you now? Just tell them to say yes whenever it touches them, when they're closing their eyes. Okay? So, and again, whenever you're testing, you test both sides. So if you test on the right, you test on the left too. So test both sides, compare the sensation on both sides before moving over to another dermatome. So we're going to start by asking our patient, sir, can you feel this? Yes. Okay, so I'm going to tell you to close your eyes. Whenever you feel this thing, you say yes. Okay, so close your eyes. So we're going to start with the deltoids, where we are going to test for C4. Yes. Yes. Does it feel the same on both sides? Yes. So from the deltoid, we'll go over to the lateral aspect of the arm, where we are checking for C5. Yes. Yes. Does it feel the same on both sides? Good. So get over to the thumb. So at the thumb, we're checking for the C6. Yes. Yes. Is it the same on both sides? Yes. So with them, we're checking the middle finger for C7. Yes. Yes. Is it the same on both sides? Then we're going to check the little finger for C8. Yes. Yes. Is it the same on both sides? Yes. Okay. Then we're checking the medial aspect of the arm for T1. Okay. Yeah. Yes. Is it the same on both sides? Yes. So we've completed the light touch for the upper limb. So for the light touch for the lower limb, test for L2 at the anterior aspect of the thigh. Yes. Yes. Is it the same on both sides? Yes. Okay. Then at the knee, we're going to check for L3. Yes. Yes. Is it the same on both sides? Yes. Then we're going to check the medial aspect of the leg for L4. Yes. Yes. Is it the same on both sides? Yes. We'll check the dorsum of the foot for the L5. Yes. Yes. Is it the same on both sides? Yes. Good. Then you check the lateral aspect of the foot for S1. Yes. Yes. Is it the same on both sides? Yes. Okay. So with this, we are done with checking for light touch in the upper and the lower limb. You can now open your eyes, sir. Okay. So the next is use what we call the neurotube. So we're going to use the neurotube to check for pain sensation, pinprick sensation. Okay, like we said, you start by testing it on the patient, asking them to identify this so that they will be able to know the type of sensation they will feel. Then tell them to close their eyes and tell you when they feel the sensation in any part of their body. So open your eyes. Can you feel this? Okay, so tell me whenever you feel this in any part of your body. Close your eyes. Okay, so go again the same way we did the other one. Yes. Yes. Is it the same on both parts? Yes. 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 Is it the same on both sides? Yes. 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 Is it the same on both sides? Yes. 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 Is it the same on both sides? Yes. 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 Is it the same on both sides? Yes. Yes. Is it the same on both sides? Yes. With this, we are done with the pinprick for the upper limb. Then we'll head over to the lower limb. Yes. Yes. Is it the same on both sides? Yes. 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 Is it the same on both sides? Yes. 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 Is it the same on both sides? Yes. 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 Is it the same on both sides? Yes. 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 Is it the same on both sides? Yes. So with this, we are done with the pinprick sensation. The next should be the temperature. If you found this video helpful, please drop a like, subscribe if you haven't already, and turn on your notification bell so that you don't miss the next one. Also share this with your friend who might need it. But as we know, temperature travels with pain in the spinothalamic tract, so it is often omitted as long as the pain stimulus is normal. So we're going to omit for temperature for now. Then the next to check for is the vibration. So you can now open your eyes. So for checking for vibration, we're going to use the 128 Hz tuning fork. Okay, so you strike the fork. So can you feel this? Yes. If it stops, tell me. Okay, it will stop. Okay. So anytime you feel it, tell me when it stops. It will stop. It stops. So you start by testing the distal interphalangeal joint, okay, at the upper limb of the thumb. So you strike the fork, then you place it. Remember, don't touch the prongs. Okay, strike it, place it, then stop it. Strike it, place it, then if the patient start feeling it, you stop it. So they should be able to determine when it stops, okay? Once I strike, if you're feeling it, tell me yes, okay? Yes. That's it. Good. So do that for the other hand. Yes. It stopped. Good. So test for the lower limb too. Okay. Yes. Stopped. Yes. Stop. Okay. You can also proceed to test the malleolus too. Yes. Stopped. Good. Yes. Stopped. Okay. That's how you test for vibration on both the upper and the lower limb. So with this test, we can see that vibration sense is intact in the fingers and the toes. Then again, the next we're going to test for is proprioception, which tests the dorsal columns. Okay, sir. So you demonstrate to the patient first. You're not supposed to hold the nail bed. You're supposed to hold the side like this, okay, when checking for proprioception. So, sir, can you look at this? Okay. So this is up. This is down. So tell me when it is up and when it is down. So can you close your eyes now? Okay. Up. Up. Down. Good. Okay. Then do the same on the other hand. Up. Down. Down. Good. So you check for the toe too. Check for the lower limb too. This is for the upper limb. Then for the lower limb, you do the same. Okay. So tell me when it is up and when it is down. 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 Up. Okay. So randomly do both up and down so that the patient cannot try to guess. Okay. Up. Down. Up. If you found this video helpful, please drop a like, subscribe if you haven't already, and turn on your notification bell so that you don't miss the next one. Also share this with your friend who might need it. So with this, we are done with proprioception. As you can see, position sense is intact in the upper and lower limbs for our patients. So with this, we are done with the sensory examination of both the upper and lower limb. And like I said earlier, remember that in exam, in OSCE scenarios, you might be asked to check for the sensory nerve examination of just the upper limb or that of just the lower limb. If you ask for the sensory examination of just the upper limb, you perform just for the upper limb. If you ask for the sensory examination of the lower limb, you perform just for the lower limb. Then again, another important thing to note, you might be asked to perform a complete neurological examination of the upper limb. So if you're asked to perform a complete neurological examination of the upper limb, that means you have to do both motor and sensory in the upper limb. In the previous video, we performed the motor examination of the upper and lower limb. So in an OSCE scenario, try to read your question very well. If you are asked for full neurological examination of the upper limb, that means you are going to perform both motor and sensory in the upper limb. And in the previous video, we explained the motor examination. Now, if you are asked for the full neurological examination of the lower limb, you perform both motor and sensory. But if you are asked for only motor or sensory of either the upper or the lower, just try to read your question very well and understand the question before answering. So like we said, after every examination, you thank your patient. Sir, thank you very much for allowing me to examine you.